authorizations, Medicare prior authorizations. So if you're watching this video on a recording later, you'll see it's about an hour long. I'm not going to talk about prior authorizations for an hour. I'm going to talk about it for about 15 minutes. And this is a live Q&A. If you're watching it later, again, this is a live Q&A as well. Once I talk about prior authorizations, I do a live Q&A. So everybody that's here live, make sure you type your questions down into chat about your experience with prior authorizations or anything Social Security. If you need help making sure you're getting all the benefits you're entitled to from Social Security, retirement, disability, survivor benefits, spouse benefits, all the rest of it, make sure you put your question down in the chat, and I'll use my decades of experience inside the bureaucratic beast to make sure you're getting everything you're entitled to now or in the future. Also, obviously, keeping up on all kinds of new changes with everything Social Security. So make sure you subscribe, and that way you can be fully aware of all the changes. Okay, enough stalling, as I always say. Let's talk about prior authorizations. So the last year that we have definitive figure for is 2022, and there were 46 million prior authorizations requested from Medicare Advantage companies. So we're talking about Medicare here. We're not talking about original Medicare, because original Medicare, if you just have Part A and Part B with a Medicare supplement, one of those Plan N or Plan G or Plan F or whatever 10 of those letters you have, most are N, G, or F, then you don't have to worry about prior authorizations. See ya, bye, have a nice day. Because how Medicare, original Medicare does it is they go ahead and approve it if your doctor says you need it and it's covered by Medicare. It has to be medically necessary. I can't go in there and get a hair transplant because that's not medically necessary. We should change the law. But anyway, if it's medically necessary, it's covered by Medicare, then you don't need a prior authorization. Doctor says, we need it. We need this operation. We need this MRI. We need this CAT scan. We need whatever. You're done. You're approved. No issues whatsoever. Medicare Advantage, if you have a Medicare Advantage company, your doctor has to ask the insurance bureaucrats whether they can give you an MRI or a CAT scan or do this surgery or this procedure or whatever. And then the Medicare Advantage company, we'll talk about the details how this happens, they will approve it or deny it or delay it, and then deny it or delay it and approve it, and whatever the case may be. So original Medicare does not have prior authorizations. The philosophy, so a lot of other companies, probably your employer health plan or something like that, they might not have prior authorizations. Again, Medicare doesn't. How do they do it? They just go ahead and approve it. And if it turns out there's some bad actors out there, doctors that are prescribing things that are not medically necessary, hospitals doing surgeries that are not medically necessary, or whatever the case may be, to fraud the system, then Medicare goes after those people and judgments and lawsuits and throws them in jail. And I'm sure you see all the time about some clinic or hospital or doctors thrown in jail for Medicare fraud. And there's more out there, but Medicare being a small agency and budgeting is getting smaller and smaller, they need our help. So if you see anything that looks suspicious, please report it to CMS. And that way, we're saving our tax dollars, all that money we paid into FICA. But Medicare Advantage, they have a separate operating procedure. They just don't approve it automatically like original Medicare. Some things they do, but there's a lot of categories depending on your Medicare Advantage companies. They all operate a little bit differently. Some will automatically approve an MRI for this particular diagnosis. Others, you'll have to go through a prior authorization, and that changes every year. So some companies are good and some companies are not so good, and it really depends. There was a company a few years ago that was using a computer algorithm to deny people. And how it's supposed to happen is your doctor says you need this, and it's supposed to go to the insurance company, and an actual medical person needs to look at it and approve it or to deny it or ask for more information, whatever the case may be. And that doesn't always happen that way. This company got in big trouble for just programming some computer to use an algorithm to deny people. In 2022, 7.4 of prior authorizations were fully or partially denied. So that's going up. In 2019, it was about 5.7%. 2020 is 5.8%. So again, the last year, 7.4% in 2022, 2023. If the trend continues, it will go up. Hopefully, it's not going up this year, but we shall see. So if we're looking at about 10% of possibly denials. And here's something I want everybody out there that has been denied. So if you, your family member, loved one is denied a particular procedure that your doctor thinks you need, then you need to appeal it. Only 9.9% of denials were appealed. So that's what obviously the health insurance companies, they do this to, save money, more profits, give their shareholders more profits, give their CEO a nice new yacht. And they use some of that money to, put nice little bells and whistles into these Medicare Advantage plans. So you're like, oh, free gym membership. Okay, well, where'd the money come for this free gym membership? It came from prior authorization denial. So they make those profits, and they are able to add nice little cute little bells and whistles into these plans. So, we don't necessarily want gym membership is fine, but we would rather have our medical decisions, kept between our doctors. And if we need it, we like to get approved. So less that and more, taking care of our health. But here's the key. 83.2% of appeals were overturned. But the problem is, again, only less than 10% of people actually appeal. So if you are denied, your prior authorization was denied, then please appeal, because 83.2% of those appeals were eventually overturned. So fight it. Get with your doctor. Each company has a different appeal process. So you just say, okay, once you get the denial, it should have on there what the appeal process is, whatever Medicare Advantage plan you have. They're hoping you don't appeal it, or they're hoping you just kind of give up, or you just say forget about it. I'll go to another company when the annual enrollment period starts. I'll just go to another company and I'll see. Or if it's a delay to the next year, and then your deductibles all start again, and so another way for companies to make more money. But there's good news. I've got some good news and I've got some bad news on this front. The good news is CMS, the Center for Medicare and Medicaid Services, has come out with a new rule. And the new rule kind of changes all this for the better. It's not perfect, but it's definitely a nice start. So the new rule, according to CMS, is they cannot provide less coverage than original Medicare, because when you sign up for Medicare Advantage, you're essentially giving up Medicare. You now have to go through the Medicare Advantage company you choose. You still have to pay for Part B premium, obviously. You still have Part A, but you can't go directly through, Medicare. You have to go through your company. So people with Medicare supplement, they just, is it approved? Is it a necessary, medically necessary? Yes. Medicare covers it? Yes. If it's 80%, then Medicare pays the 20%. If you have a Medicare supplement, they can't say anything. If Medicare pays their 80%, your Medicare supplement company has to cough up the other 20%, or whatever if it's a hospital, they have to pay the deductible, whatever the case may be. They have no say in it whatsoever. If Medicare says, yes, pay it, then that company has to pay it. No ifs, ands, or buts. But Medicare Advantage is supposed to cover the same type of things as original Medicare, but often, they kind of work around the edges a little bit in order to make, more profits for their shareholders. And they're doing very, very well, making billions of dollars. And the delays, CMS has made a big decision on the delays. So the response time up until this is only going to start 2026, unfortunately. So from 14 days to 7 days, starting 2026. And for urgent requests, 72 hours. So a decision has to be made of an approval or denial, or whatever the case may be, within 72 hours if it's an urgent request for a prior authorization. If it's not an urgent, then they have to have it done by 7 days. And another part of this is they have to publicly report their stats. And this one looks like it's going to be delayed until 2027 because the health insurance companies complain that, okay, we're going to have to build a new computer system to, monitor all this information and then pass it on to CMS and all the rest of it. So they, finagle themselves another delay. And this way, with the statistics being reported to CMS can therefore, figure out, hey, this particular company is not doing the right thing, and let's monitor them a little bit closer. That's all. This is the good news. The bad news is, remember, these are new rules. These are new rules by CMS, a bureaucratic agency. And remember, several weeks ago, the Supreme Court came down and they overturned Chevron deference, which basically says, no, these bureaucratic agencies cannot reinterpret the law like this. So basically, CMS, up until this, for the past 40 plus years, CMS, Social Security, all these different agencies, the Food and Drug Administration, they were able to take congressional laws and say, okay, Congress, you didn't really, Congress sucks at writing laws. We all know that. Very, very vague laws. And they leave it to the particular agencies to interpret the fine details. So in this type of thing, they, Congress wrote a law about Medicare Advantage, and then they're supposed to provide this, and, they can do prior authorizations, but CMS has now come down and kind of tweaked it a little bit to improve it. But now the Supreme Court says they can't do that. Well, they can until they're sued. So here's what I think is going to be happening soon, because these health insurance companies don't like these new rules. They want to be able to, rule their own world and make the decisions for us. So I keep looking for a lawsuit, and it hasn't come yet, because these rules are relatively new. So I am looking for probably a lawsuit, usually in Texas. They find a sympathetic judge somewhere in the country, and they go there and they say, oh, these rules, the CMS has no authority to make these rules, and all of this might be completely wiped out, and they might have to go back to 14 days or 21 days for authorizations. So I'm going to keep an eye on that. Hopefully it doesn't happen, but this is cutting into the profit margin of these companies. So I'm pretty sure it's going to happen. What will have to happen then is we'll have to demand our politicians to actually make a law, not a bureaucratic rule, a law that says these companies have to do X, Y, and Z, and they have to write it in super detail. Yeah, and our politicians, what, $400 million last year by the pharmaceutical industry for lobbying. So that's going to be, so anyway, I hate to get off on a negative note there, but temporarily it is a good thing on prior authorizations. But whether the law changes or not, then make sure you definitely appeal those. Okay, let's go ahead and get into your questions. That is enough for prior authorization. If you've got a nightmare story, make sure you put it in the comments down there. And yeah, well, there's a lot of out there. All right, let's see here. DJ, when doctors make a request to Medicare for a PA, are there regulations of how long Medicare can take to make a decision? Request to Medicare. Make a request to Medicare. No, for a request to Medicare, they don't have to make a request to Medicare. You probably mean a request to your Medicare Advantage company, your private company. And those are the ones I just talked about, 14 days. But now it's supposed to go down to 7 days or 72 hours if it's an emergency. So yeah, if you're talking about original Medicare, there is no prior authorization. I have an appointment with one of your advisors today, and I can't wait to talk to him. Thank you for the education, all your work. All right, perfect. Yes. Because there's so many bad actors and so many fronts out there. It's the old Marine Corps, can't get things done, just do it yourself. So I put together a team that helps people with Medicare, and I'm getting lots of messages and calls and emails because next year there's going to be a lot of changes with Medicare, not only prior authorizations, but because of all that, A lot of Medicare Advantage companies are leaving particular areas. There's new regulations and the Part D program. So Medicare Advantage companies are cutting back on a lot of their extra benefits. They are increasing cost sharing for doctors and MRIs and CAT scans. They are pulling out of whole areas, the Southeast, Florida, Missouri, other places. I see in the news continuously companies say, yeah, we're not making enough money here. If you're in a rural area, country area, desert area, not a large population, you're going to get a letter next month, and make sure you read it, because there's going to be a lot of changes. And if you need help, I'm getting a lot of people requesting help. And so we're getting focused on that. The new plans come out October 1st, and you can click on that and we can put you on the list where the new plans come out, and we can compare what you got with what is available out there. And if you're in the best thing, you don't have to do anything. You just stay where you're at. But if my team can find you something better, they will let you know. DL, I only have Medicare Part A. I need minor surgery and was told I needed prior authorization from a doctor, but A doesn't pay the doctor visit. I'm going to the emergency room for that. Yes, that is correct. It's strange. Medicare Part A pays for the hospitalization, but what they do in the hospital is done by the doctor. So that's paid for Part B. So people think all the time, so I'm going to the hospital to get an operation, I don't need Part B because it's in the hospital. No, no, no. Part A covers the hospital bill and overnight, and there's a $1,632 deductible for that. But the actual surgery and anesthesiologist and all that kind of stuff is paid for by Part B, and it only covers 80%. So you have to pay out of pocket the other 20%. That's why people get a Medicare supplement plan, or they get a Medicare Advantage plan. I always recommend Medicare supplement plan if you can fit it within your budget. That way you don't have the prior authorizations and networks. But unfortunately, a lot of people can't fit it within their budget, so they go to a Medicare Advantage, which is okay as long as you keep up on it. You have to keep up on it every year. Carla, can I collect my early retirement at 62 starting in October this year and not be penalized if I still work over the 22,320 amount? All right. Yes, possibly. So this is your first year. So if you start your benefits in October, I'm thinking you turn 62 in October. One thing is you have to be 62 the entire month. So if you were born October 1st, you can start in October. But if you were born on any other day in October, then your first benefit amount comes in November. So that's number one. And even if you went over, let's say, I always exaggerate. If you made $1 billion up until today, but starting next month, you're going to stop working, or you're going to stay under the monthly limit. This year, the monthly limit is $1,860. So if you stay under that monthly limit next month going forward, then you can start your checks, no problem. So if in October, November, you went over that $22,320 for the entire year, no problem. As long as you stay under 1860 starting October, November, December, then you're good. And next year, you have to stay under the yearly limit. There is no monthly limit. The monthly limit is only the first year. Man, thank you for cleaning things up. You're welcome. Spouse. Well, a dear friend of mine, I love to hear this. People looking out for other people. We need more of this. Who took early retirement at 62, continues to work at the age of 76. Will those extra years be helpful in increasing her monthly benefits? Thank you for all you do. Yes. So people could conceivably receive 2 benefit increases every year: COLA, and if they worked, because you're going to pay FICA forever. So as long as you've got wages or net income, you're going to have to pay FICA on those, even if you're collecting Social Security benefits. But if you are working, and that's one of your high 35 years, because that's how Social Security determines your benefit amount, by your high 35 years, then Social Security will look at that and recalculate your benefit. So what happens is she files her taxes next year in April or so, and reports that to the IRS. The IRS reports that to Social Security. Social Security looks at the earnings for this year and says, hey, is this one of her high 35 years of earnings? If it's one of the high 35 years of earnings, they kick out the low one, add in that new one, recalculate, and your benefit goes up. It usually takes longer. You get the COLA increase. Everybody gets the COLA increase at the same time, super, super quick. But the high 35 year, the extra earnings recalculation, that takes a little while because you have to file your taxes and it has to go to the IRS and Social Security. So, April, May, June, July or something. But if it increases your benefit by, let's say, $10 a month, then they will pay you. If it took them 6 months to do it, they'll pay you $60. They'll pay you every month for starting January, and then extra $10 for the rest of your life. So that's how that works. Do Advantage plans cover the Part B 174? No. Yes. No. Yes. Um, there are plans, Medicare Advantage plans out there that do cover some or all of the Part B. But if you have a Medicare Advantage plan, you have to keep your Part B. If you get a Medicare supplement plan, you have to keep your Part B. But there are some plans out there called Medicare Advantage Part B Give Back, and usually veterans, that use the VA medical system, they are very popular with them. A lot of them don't have prescription drugs put in there because the VA has a better prescription drug program because the VA can negotiate their prices on drugs, and now Medicare can finally, after trying for decades. Crazy. The whole system is crazy. But these Part B givebacks, if there's one available in your area, then you sign up for them and they pay for your Part B premium, $50, $100. Some of them I've seen pay all of your Part B premium. But be aware that, again, these companies don't get to be billion-dollar companies for nothing. If they're going to just give you that free money, even though it's your money that you paid in a FICA, if they're going to give you that money on a monthly basis to pay for your Part B, they're going to take it out of someplace else. So you've got another plan that doesn't pay, and if you go to the hospital, you pay $100 a night for a hospital. The one that pays for your Part B, they might charge you $300 a night for the hospital. So as long as you're healthy and you're, don't anticipate in getting injured or anything like that, and you're young, Part B give back, you want to save some money, doesn't hurt. But remember, so what people do, they say, well, I'm 65 and, I think I'll be good next year for a couple of years. So they go ahead and get the Part B give back, save yourself that money, take a nice little vacation to Hawaii or something. And then once they turn 66 or 67, 68, they move to another one that doesn't pay the Part B, but covers them better. And the reason a lot of these plans, particularly the ones without prescription drugs, which you do need a prescription drug plan, but people that use the VA medical centers, they don't need a prescription drug plan because they're happy with their VA. So a lot of those plans are called Patriot plans or Honor plans because they're focused on people with, VA coverage. Barry, not working, no income, paying for COBRA with Medicaid, with Medicare. Medicaid is a welfare-based program, so you're probably talking about Medicare. Secondary, COBRA expires next month. If I draw from a 401k, can I qualify to get ACA subsidies rest of the year? I tried online calculating for the rest of the year. Okay, so if you're getting, so if you have, I'm trying to figure it out here. If you're getting Medicaid, or if you have a 401k, you probably don't have Medicaid because you have money in the bank. If it's over a few $1,000s. So you're probably meaning Medicare. And if you have Medicare, then you can technically get Affordable Care Act, Obamacare, ACA, but you cannot get any advanced premium tax, savings or cost sharing or anything like that. So no, if you have Medicare, then you need to, get Part A, Part B, and find a Medicare plan that you like, a Medicare supplement or a Medicare Advantage plan. Let me see, Barry, second part of that question. But it only used 1/4 of the dollars I say I would draw. I assume that's a last quarter thing. Will it work that way using a quarter of the rest of the year, or is a full withdrawal good? Okay, yeah, give 401k financial advice like that. Joe, SSDI was denied. If it's been over 6 months since denied, can I apply again with new evidence? Yes. I, yeah, wish you would have appealed that initial decision. That's always the best way to do it. But 6 months is probably going to be tough. But if you have some type of extenuating circumstance, then you can request a what's called a good cause of why you didn't do it within the the 60 days or whatever, 65 days actually. Um, but yeah, if you were in the hospital the last few months, or you were overseas, or you didn't get the mail, or whatever the case may be, then I would try to file a request for reconsideration and reopen that case, and that way they've got all the stuff. And then if you got new evidence, you add the new evidence. Yeah, absolutely. But it's always good to go to the second stage so someone else reviews it. And then if you do have an extenuating circumstance like that, you do the SSA 561, the request for reconsideration, and then you just add a good cause statement. You can do it on a Social Security form. It's SSA 795, but you can just do it on a piece of paper. Say, I was in the hospital, I didn't get my mail, whatever the case may be. I, you know, when before I became the manager of the third business Social Security office in the country, one of those sections I did work in is appeals, and I would get good cause statements for delayed filing like this all the time, and I approved every single one of them. So that's because I'm a softie. So, hello, Dr. Aiden. Everyone, thumbs up, please. Yes, thumbs up. That's how we get information out there to everybody to help them out. If my retired husband has original Medicare, not Advantage or Supplement, and I enrolled him on my workplace insurance, will that be a good plan? How will it work? Um, yeah, if you have original Medicare, just that, and you have health insurance through work, and it's your current work, and your employer has 20 or more employees, that's fine. Then you technically he doesn't even have to have, Medicare Part B. If he's receiving money benefits, then he has to have Part A, and it might be a good idea to have Part A anyway because it's zero premium per month, and it might cover some of the deductibles that your health insurance from work doesn't cover. Um, so yeah, if you just put him on your health insurance from work, then yeah, he doesn't need to pay for the Part B. Save himself the $174.70. Refuse it, and then later on, once you stop working and he stops receiving health insurance from that work, then sign up at that time. There's no penalty whatsoever. Joe became a silver member. Appreciate it. Thank you very much. Get my coffee IV for the month. Thank you. Lola, Sunshine, I'm confused because everything is new for me. How know which Medicare I have? So if you have Part A and Part B, you've got the card, the red, white, and blue Medicare card. It doesn't have your Social Security number. It's got a new Medicare number on there now. And then if you have another card that I always try to avoid company names, then that's probably a Medicare Advantage card. But you can, if you want, you can call the number, email me, and I can have one of my people look. And all you have to do is provide your Medicare number, and they can look it up, and they'll tell you exactly which plan you have, and they can even schedule you for October if you want to review that plan. But if not, at least they'll be able to tell you what you got. That way, you can make your decision. Maxine, I am retired, have Medicare and a supplement. How much contract work can I do before I have to file to pay more into my Social Security? How much contract work can I do before I have to file to pay more? Not sure what the question is. Um, Contract work. Yeah, if you contract work, maybe you're 1099 or something. So if you're 1099, your taxes are your responsibility. So you have to file your own taxes, including FICA taxes, self-employment tax, and all that. So I just started getting my FRP 2 months ago. I have Social Security withholding 20% for taxes. I want to change that, and I hold that 20% in an interest. Yeah, so you've got the voluntary tax withholding. You filled out that little form, the W-4V. I think they just moved it to online. Yeah, people do that all the time. They kind of tweak it. So if you look like you might have to pay more taxes, or you want more withheld or less withheld, then you just refill out that W-4V, and yeah, Social Security can withhold whatever amount of taxes, 7%, 22%, whatever. So very, very easy. Barbara, I am 62. If I get married, does that disqualify me from survivor benefits? Nope, you're good. If you remarry after 60, that does not affect your survivor benefits. So you are 100% good. All right, let me see. We've got some questions. I'm also doing another one. I turned 66 on May 2024. When can I file to receive full benefits? Yeah, then to receive full benefits, you have to wait till your full retirement age. So about 2 or 3 months before your full retirement age, then file then. But kick around the numbers. Sometimes if you file X amount of months early, sure, it's going to reduce your benefit by 5, 10, $15 a month. But then again, you'll get all those checks 6 months earlier, 10 months earlier, whatever the case may be. So make the best decision for you. A lot of variables there. Um, Thank you. Had my appointment yesterday. I got my spouse's retirement and found out because of you. All right. Awesome. We found more money for people. Yes. Didn't know they're entitled to spouse benefits. And now spouse is getting some benefits. All right. Good deal. I think we found millions and millions and millions, hundreds of millions of dollars, probably in lifetime benefits for people. Well, I didn't. I just, as I always say, I'm just some idiot in front of cameras talking for an hour. It's y'all who share this and subscribe and like and send it to your friends and stuff like that. So thanks the community out there of all the people that press share and like. That's how that person got extra money for their family. Awesome. Good job, everybody. I can get my exes, which is several $100s more with proof. They gave me a few months to find it. Perfect. Yes. Yes, that is a key. If you're going to file for spouse benefits or divorce spouse benefits or independently entitled divorce spouse benefits or disability benefits or anything, don't wait around for your proof saying, oh, okay, well, I want to file for divorce spouse benefits, but I requested my marriage certificate or divorce decree and it won't be here until next month. So once I get it, I'll call Social Security. No, 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 no. Don't do that. You're going to lose possibly a month of benefits. Call Social Security, set up the appointment, go ahead and file online, whatever the case may be, and then go get your proofs. Because sometimes you might not even need it, like a birth certificate. Usually don't need those. Marriage certificate, if your divorce spouse mentioned and provided at that time or something, usually not that. But anyway, file the claim first, set up an appointment first, because that you have what's called protective filing. So if you call this month and set up an appointment and your appointment is until next month, then that's fine. You set up the appointment and then start getting your documentation. And if you don't have your documentation at that time, go ahead and keep your appointment and they'll tell you, oh, okay, yeah, no problem. We'll wait for that. But you can start your benefits this month instead of the next month when you actually have the appointment. So it's important that you set up an appointment and get that protective filing for this month so you don't lose that money. If a person is diabetic and have toes removed, what is the odds of getting disability? Yeah, I always kind of punt on those questions because, I've taken hundreds of thousands of disability claims and some of them were approved that I'm like, oh, and some were denied that I'm like, yeah, that definitely should have been denied. But just try it. Watch my videos. I did 3 videos on the filing process, how to file, tips, tricks, and secrets I learned over decades of taking hundreds of thousands of claims. Watch those videos and apply. Because, it depends on your age. It's easier as you get older, your education background, and other things, other type of side effects of the medication or other smaller issues that might not be disabilities on their own. But so file. All they can do is say no, and then you request an appeal. Always request the appeal, even on these prior authorizations. Please, let's hold these companies accountable. Because remember, these companies, these Medicare Advantage companies, this isn't their money that they're hoarding. This is our money. All the money you paid into FICA. So FICA is 6.2% goes into Medicare, 1.45% goes into, 6.2% goes into Social Security, and 1.45 goes into Medicare. And then your employer pays matching. So that money that you paid into FICA Medicare for decades, that money is sitting in Washington somewhere. And when you sign up for XYZ Medicare Advantage company, that company takes their little cup and they go to Washington and they say, hey, give us this person's money. And Medicare gives them a certain amount of money every year to take care of your health. So that's your money. That is your money. So these companies aren't doing you any favors. They're just holding your money and they're being stingy with it. So get your money back. And the way to do it is hold them accountable and check your plan, review your plan on a regular basis, because you might like your XYZ Medicare Advantage company. You've had it for 2 or 3 years, but those contracts are only good for 1 year. So you've only had your plan for 8 months. Last year's plan was different. You might have the same card, the same company name, the same doctor, the same zero premium, but it changes every year. And they change stuff that you don't necessarily notice until it's too late. They change the stuff under the hood. The last year it might have been $100 if you go to the hospital. This year $200. Next year it might be $300. MRI 20, 30, $400 next year. You don't know. So that's why it's important to review your plans every year. And companies, they don't want you to review your plans every year because they want you to keep on the old plans so they can come out with the new plans, because these companies have multiple plans in the same area. So your company probably has 2, 3, 4, 5, 6 different models in your area. So you've got the old 1972 Pinto version, and they just came out with the new, Corvette, and they don't want you to switch to the Corvette. Same price, same savings, more savings, because they want your money. So that's the strategy. So let's beat them at their own strategy. All right, let's see here. Richard, I had a stroke and was deemed disabled in 2022. I received a lump sum check for about a year or so later. This year, I am being told that I was given a letter of overpayment with no explanation of how. Yeah, number one, requests explanation of where that overpayment came from. That's the start. Yeah, they should have had in there where the overpayment originated, and they just changed the rules for overpayments. I did a few videos on that. So number one is on yours, you want a explanation. So SSA 561 is probably your best bet to start with. That's a request for reconsideration. And so you say, hey, number one, I want you to reconsider this overpayment, and number two, I want you to tell me what the heck it's for. Give me a particular details of where that overpayment comes from. And then once you do that, watch my videos or come back here and we'll walk you through the other steps. But starting off with a 561, SSA 561, it's a small form. There's only 2 or 3 lines that you can fill out on a 561. So just put in there, I disagree with the overpayment, and tell me the details of it. And that's enough usually. If you want to go into more, just add another piece of paper and just put like see attached. How long in advance should my wife sign up for a supplement plan? She turned 65 in March. Yeah, a couple 3 months. So if she gets her Medicare numbers, as soon as you get your Medicare numbers, then find a Medicare insurance agent or prefer a broker that works for multiple companies. That way they work for you and not for the company. So yeah, 2 or 3 months before is fine. And if you want help, just reach out to us and we can definitely help you out. E-Truth, Dr. Weir is the man. Oh, thanks. He definitely knows his S. My elderly neighbor's son had a stroke overseas. He is back in stateside. What benefits can she apply for to help him out? If SSI, how long will it take? So yes, if elderly son had a stroke, moved back, definitely apply for disability. When you apply for Social Security disability, they will take a claim for both programs, SSDI and SSI, and see if you're eligible. but both of those are based on a disability. So they'll have to take the claim, do it as soon as possible, do it immediately, please. And then they will get all the medical documentation. And if he's been overseas and has medical records from overseas, then he might have to provide that. But if not, then they'll have him do a CE, a consultative exam, where they send him or him, right, to see a Social Security doctor. But yes, disability benefits immediately. And if he is approved for SSDI, then after 2 years, he will get Medicare as well. So, Doctor, I live in Pennsylvania plan. I remember talking to Social Security about an insurance question in December 2023. I currently have a Medicare Advantage plan. They told me I can switch back to original Medicare. Yeah, if you do it within 12 months, you got like a trial right, you can switch back. Or if you're healthy, you can switch back anytime. So, yeah, it doesn't hurt. But if you have a Medicare Advantage, you can't do it generally until the annual enrollment period in October. So, your broker, whoever, get with them or call us up, and they'll find a Medicare supplement plan that you like, an N or a G. I always recommend N because I'm cheap like that. And then it'll take effect in January. And if you're outside of that 12 months, or there's not another exception they can find, then you'll have to go through medical underwriting, which is not, you don't have to go get a physical necessarily. It's usually just they ask you, 20 or 30 questions. Richard, I have an appeal in, but that's been since February, March. What can I do? They still have not explained and will start withdrawing overpayment. They just say, wait, it's going. Okay. So, all right. So you already did the appeal. So perfect. Awesome. February, March. Yeah. Appeal shouldn't take that long. Yeah. Social Security is way understaffed, the worst in decades. But if they start withdrawing the overpayment, they shouldn't withdraw the overpayment while they have an appeal pending. But you can, at the very least, once they make the decision, then you do the SSA 632 and you request a waiver. And the waiver, in order for a waiver to be approved, two things have to be met. It's not your fault and you don't have the ability to repay. Both of those things have to be met. So I would request that. And if they deny it, just go through the process and eventually get to see an administrative law judge. An administrative law judge has a lot more freedom to kind of read between the lines. So if eventually, you set up the lowest overpayment you can. So if they're going to start withholding, $10 a month, $20 a month, $30 a month, whatever you can afford. And if a year later they decide to waive it, your overpayment, then they will give you all the money back that you paid into it from the beginning. So, Sunshine, my husband is already past full retirement age, still working and trying to get delayed retirement credits for boosting his checks. Just learned from your video about minor child benefit. We have one. Should we file ASAP? Yes. Yes. That is another consideration on when you should take your retirement benefits. Do you need the money? Tax, does it put in a higher tax bracket? Are you healthy? Do you have a longevity in your family? But another deciding factor is if you have children. So you're like, well, I'm going to wait another year because that's going to boost me up another $40 a month for the rest of my life. But if you have a child under the age of 18 or became disabled before the age of 22, that child can receive 50% of your full benefit amount. So that throws those calculations out the door. So if you have a child that's coming up to 18 or about to graduate high school, then maybe the delayed retirement credits is the best way to go. But if you have a younger child that is going to be receiving a check for many, many, many months or years, then that might be the best way, is to go ahead and file for benefits and get those checks. But remember, if you're going to receive spouse benefits on your husband's, then your benefits are based on his full benefit amount, not the delayed retirement credits. But surviving spouse benefits are based on delayed retirement credits. So surviving spouses can get those delayed retirement credits. So you have to figure that out as well. So yeah, so there's a lot of moving parts there, but you're definitely in the right direction. Rich kids living on poor people's money, nothing in America. Yeah, yeah. This is from a good friend. I took my benefits age 62 and now 77. The past 2.5, 3 years I worked, had Social Security deducted from 48,000. Should I have gotten an increase? It really depends on what your other earnings were throughout your life. So if 48,000 was one of your high 35 years, yes, you should have got an increase. But if it wasn't, then no. Thanks for everything. Sorry I was late. Did you speak on divorce spousal benefits, the changes, and who is the best Medicaid plan? And did you speak on divorce spouse benefits, the changes? Yeah, there's no changes to divorce spouse benefits. There are some that are trying to change it, but no changes yet. The best Medicaid plan, there's only one Medicaid plan in each state. Medicaid is the welfare-based program. You talk about Medicare probably. And I is this company better than this other company? There are no clear winners. It really depends on your doctors, your medical needs, and your particular area. So one particular XYZ Medicare Advantage plan might be the best one in your area this year, but it might be terrible next year because another company comes in and they compete. So this is good. These companies compete with each other. So that's why you should review your plan to take advantage of that competition. If you just, say, well, I don't want to mess with it. Well, that's good. Then you just ask a broker to mess with it for you and then just tell you what to do. Right. Says, yeah, just find me a best plan and go, let's go for it. But those companies hope you don't review it and you just stay with the old 1972 Pinto. Sorry, fans of 1972 Pintos. So. Great. Thank you for your time. I appreciate it. Thank you. Thank you. If my mom has her divorce decree will it suffice as evidence if it says dissolved 20 years of marriage? I'm not sure. Cut off there. Yeah, so sometimes those can be used. I think what you're asking, because I've done this a million times, is that you can't get a hold of your marriage certificate for whatever reason. You should be able to, unless you were married overseas. I've never had anybody have an issue getting a marriage certificate, unless it was overseas. But if all you have is the divorce decree, the original divorce decree with the stamp or the red seal, and it has on there when you were married, bride, groom, an actual day, month, year you were married, Social Security can sometimes use that if a marriage certificate is not available. I received my own disability, but my husband is deceased. I received some of his Social Security. How can I make sure that I'm receiving the maximum amount of his Social Security? Yeah, that's difficult because the only way is to, hopefully when he was receiving benefits, he checked his work history to make sure his benefit amount is correct. You could check it, but then you would have to know, all the places he worked for 35 years to make sure it looks correct. But so Arnita is a good example. She did the right thing, but there are so many tens of millions, hundred millions of dollars out there probably sitting around that people are not collecting because they're not smart like Arnita, that she is receiving disability on her own record and she's receiving survivor benefits. So there's a lot of people out there receiving disability that think, well, because I'm receiving disability, I can't receive survivor benefits, or I can't receive spouse benefits, or I can't receive divorce spouse benefits. No, that is 100% incorrect. You can collect disability benefits, and because you're going to continue receiving disability benefits, you'll continue to get Medicare. But if you're divorced or spouse or deceased spouse, benefit amount is more. If you're entitled to more money on that, they will just add it on top of the disability benefits. So you'll get disability plus survivor benefits, disability plus spouse, disability plus divorce spouse benefits. So you can get both of those. So not total together, one subtracts from the other, but if there's more money, then you get that other money. So Arnita did it correctly. And so, yeah, but in terms of knowing, the only Difference would be if the work history was incorrect. Thank you, my friend. One of your brokers is calling me in October. Awesome. Yes. We haven't, we've gotten hundreds of requests for help in October. So if we've got your request, we've got you on the list. We haven't responded yet. We don't like to harass people. So we'll reach out to you when we're ready to schedule, but we haven't forgotten about you. I hate all those emails and texts and stuff like that. So currently draw on deceased spouse since 60, but have ex with 10-year marriage. I'm 64. Can now I change off to ex-spouse if he is drawing benefits? Yes, but usually surviving spouse benefits are more, but it really depends on how much the benefit amount is. Um, but remember, if you are receiving surviving spouse benefits, you don't have to touch your own. But if you receive spouse benefits, divorce spouse benefits from someone that's still alive and kicking, then you have to file for benefits on your own. And then you get up to 50% of that benefit amount. And then then your surviving benefits will essentially stop because you're switching over to there. So I would check out the numbers. But usually surviving spouse benefits are more because you get up to 100%. Living spouse benefits are up to 50%. So check out the numbers and make your decision based on that. Do you know how much our Medicare is going to go up? No, nobody really knows. But I figure it's what, $174, 10 bucks, maybe 185-ish or so, but they haven't made the official decision yet. So or probably about 10 bucks. At 65, could you apply for SSDI if you're already on Medicare? Absolutely. And if you're already on retirement, then they'll just take the months you've already received retirement. And, so it might increase your monthly benefit amount, but it might not. So if you're disabled and unable to work because of your disability, then apply. But, first ask them, says, hey, again, if you're already taking retirement benefits, because early retirement benefits and then switching to disability, you're not going to get the same amount as if you just filed for disability. If I miss the 10-year mark by 5 or 10 days, can I still qualify to draw spouse benefits off my ex-husband? No, unfortunately. Yeah. I just did a video yesterday on all the exceptions. I just did it, probably about 5% of the Social Security exceptions. But I did the most important exceptions yesterday. But unfortunately, this one is not an exception. Other than if you were married to the person, divorced them, remarried the following calendar year, married the same person, then they can add those two periods together. But I'm assuming that is not you. No, you had to be married exactly 10 years. Yeah. Yeah, they're very strict about that. Ed, hello, I got you live. I think you read one of my comments weeks ago. I'm on widow's benefits. That's just this year, last week, I got a 1099 tax form saying I made a lot compared to, is there another? Yeah, so a 1099 tax form from work you were doing. So remember, it's your responsibility to go ahead and do all the taxes and pay FICA and all that kind of stuff when you do a 1099. All right, let's see if we got any questions on this other one here. Medicare SSDI and Medicare A and B. Am I leaving anything on the table? So you're getting SSDI and you got Medicare Part A and Part B. Yeah, you have to get something to cover all the gaps because, like, for instance, Medicare Part B, it covers 80%. So if you have a $100,000 surgery, you have to cough up $20,000. And because you have SSDI, probably in your state, the only thing that's available is probably a Medicare Advantage plan. Because most states don't make health insurance companies offer Medicare supplements to people under 65. So, yeah, so you get a Medicare Advantage plan to cover all the gaps. So if you need help, just reach out to us. On my front page there, you'll see my phone number, email. So just email me and say, hey, I need X, Y, and Z. I need to see what's available in my area. So my brother-in-law receives SSDI. Can my sister receive Social Security from his benefits? She will turn 65 in September. She hasn't worked much. Yeah, absolutely. If you've got a spouse that are receiving benefits and he has to be 62. Um, and then she can receive spouse benefits. Yes. And but she has to file on her own, even if it's, $50, she has to file for benefits on her own record. But if she's not entitled, then no problem. And then she'll get up to half of his benefit amount. Or if they have any children under the age of 16 or became disabled before the age of 22, she can receive benefits called auxiliary child and care benefits. And that is 50% of the benefit amount, of his benefit amount. All right, let's see. On disability, can I get a Medicare disadvantage plan before I'm 65? Yeah, a lot of people call it the disadvantage plan. Um, yeah, the thing is, insurance companies are all regulated by the states. So some states, they make the health insurance company provide Medicare supplement plans to people under 65, but these health insurance companies don't want to. So they usually, talk to the state politicians to make sure they don't make them. But when you hit 65, then you're just going to get a Medicare supplement based on your 65. So they can't deny you, they can't charge you extra or anything like that. But a lot of people, unfortunately, in most of the country, if they're on disability under 65, then they have to get a Medicare Advantage plan. But again, they can switch once they turn 65. All right, we are at an hour there. Let's go ahead and call it a night, and I will be back in tomorrow with a video on a nice little gift Congress just might give to retired government employees. So